It is a problem for some of us. One of the difficulties in my own case is starting a new relationship. You really don't want to go out and say, well, here's what my problems are. In my own case, the first lady that I approached and wanted to start a relationship with, her answer was no. I am not ready for this. I mean, it didn't kill me. It didn't beat me down. I just continued with my life. There is treatment. And if one is open to that, one can continue to live a good life. For the individuals who are married and have a relationship prior to this occurring, it's a question of understanding, talking about it. And this is why I encourage the new diagnosis when they come into our group, or I'm asked to counsel with them, I encourage them to come with their partners. Unfortunately, I did not have a support group, having to determine without any consultation as to what mode of treatment I was going to have. And I chose prostatectomy. One, it was in, it was out, it was simple. I had no way of determining whether it was the best, second best, or worse. It was simply based on my fear. I was going to go in, have it done, and I was going to be out. I went home after 5 days to a home that was empty, alone, not knowing what to expect. It was a really difficult time. The following 3 months, I went into deep depression. I somehow pulled myself through and made the determination there and then that I decided to go and speak about it. I have been speaking for 5 years, speaking to small groups, speaking to individuals. My home number is public. Anyone from across the country who gets hold of it and want to know anything about prostate cancer, I am willing to talk to them about it. One of the things that happens to me is that I suffer from incontinence. Many of us who are treated for prostate cancer do go through this. Some is short-term. Unfortunately, in my case, it is long-term. This adds additional burden, personal cleanliness, additional medication, having to purchase additional commodities, and it's a financial burden, it's a financial strain. But life goes on. I have life, and that's important to me. My name is Jim West. I'm 67 years old, and I am a 7-year prostate cancer survivor.